Basically, there's three different types of patients that we see at the Wound Healing Center, and those patients are diabetics who have ulcers or wounds that haven't healed for some time and many times get referred over by their doctor for specialized treatments. The other types of wounds that we see are venous stasis wounds, which are wounds related to problems with circulation on the venous side and the many times lower extremities. And the third type of wound, major type that we see, is pressure ulcers, which we see most often in patients who are debilitated, bed confined, or wheelchair confined because of various illnesses such as stroke or neurologic disease. The reason diabetics are more prone to have ulcers, particularly on their feet and lower extremities, is because of neuropathy, which many times strikes diabetics after they've had the illness for 5, 10 or more years, and their control of the blood sugars has not been as good as it could have been. Other treatments that we pursue that are unique here are debridement, regular debridements of these wounds, in which we try and get the wound from a chronic phase where the wound is not moving from its normal healing phase into a more proliferative phase towards resolution. Many times diabetics, their immunity and their healing process is not normal, and so they need additional help, counseling, to try to get their blood sugars under better control, as well as debridements, which is cleansing of the wound to try to remove impediments to wound resolution. Other things that we do here that are not found in other doctors' offices are treatments such as aplograft treatments. These are cultured cells taken from babies' circumcision, the foreskin, and they're cultured in a laboratory and then sent to us, and we can use that tissue to help these wounds towards resolution. And it's worked very, very well since that was introduced some 10 or 15 years ago. Another treatment that we use here that's unique is hyperbaric oxygen, which we have 2 chambers, and we can take and expose the wounds to concentrated oxygen, if you will, under pressure, which promotes what we call free radical formation, which is very toxic to bacteria and helps increase the oxygen content of the wound, which oxygen is an enemy for infection and bacteria, and that also helps promote wound healing. The other type of wound that I mentioned earlier, venous stasis wounds, are wounds typically in folks that have problems with their veins. Many times they have varicose veins, but they will form ulcers in their lower extremities that have a hard time healing. And in those people, we try to use compression to bring about a decrease in the swelling of the lower extremity, which then promotes better circulation, which allows for healing. Patients who see their regular doctors can be referred by their regular doctor, general practitioner, to the wound center at Knapp. Medicare patients also have the ability to self-refer. As far as the first appointment, Normally, this is a more thorough, longer appointment than the follow-up appointments. You can expect a very detailed history and physical examination by the physician. In addition, the nurses are making their assessment as well. You may want to consider bringing someone with you, especially in the cases of where the patient is unable to give a complete history or cannot speak. As far as the actual procedures that we perform, normally we place some type of medication on the area to be treated prior to debridement so that this lessens the amount of pain that a person has during the procedure. And if necessary, we can use other modalities as well to lessen or numb the pain. Normally, the first appointment can last up to 45 minutes. After that, it's usually not that long. It would be greatly appreciated also if a complete list of medicines and the medicines themselves are brought to the initial visit.